Hi, my name is Ashley with Complete Health Benefit Solutions. I've had the pleasure over the past month of speaking to so many Railroad retirees from across the country and about several different topics. I wanted to do a quick video because throughout the process, throughout talking to so many different retirees and retirees in various situations, I noticed that there were really 5 main areas of concern or areas that people needed clarification and had a lot of questions on that I was really having in every conversation. Either it was one of the 5 or one or more of the 5. It was really the same kind of topics over and over. So I wanted to touch on that with everybody. But first, before I go into that, I did want to take a minute to introduce myself and put a face to Complete Health Benefit Solutions. So again, my name is Ashley. I am the founder of Complete Health Benefit Solutions. I am an independent insurance broker. The way I got familiar with Railroad retiree benefit options is because my husband's aunt had called me wanting some help finding some affordable health insurance because her husband, who worked for Union Pacific, was retiring April 1st and going on Medicare. And so in helping her, she didn't want to pay $750 a month for a high deductible health plan that she knew she probably wouldn't use much. And if she did use it, it means she'd be spending thousands of dollars out of pocket. So we found her much more affordable coverage. And in talking with her husband, he was going to use his local agent, which fine, is all great, but I have extensive background working with retiree benefits. Not a lot of people have that same background. I actually started working for 1-800-Medicare when I was in college at the University of Kansas. So really, that is why I have taken the time to dig in to this information. I had a need to do it to help my husband's family. And when I realized the kind of level of, I guess, lack of information out there, is what prompted me to kind of put this together. And as I've had all these conversations, there's layers, different people have different things available to them. So I've put in all this legwork and have all this information and really just want to get it out to you guys. But it is so much information. I want to make sure that I'm getting you. So the 5 things, the 5 topics that I found myself just repeatedly talking to people about, I kind of put into these categories. And they are, number 1, they were joining Medicare soon and either needed help understanding Medicare period or how Medicare would work with their UP options. There are just a couple of points that I would like to make just real quick. So there is a very big difference between the plans that are available to you, how much you're going to pay, different things depending on the state that you live in. When you join Medicare for the first time because you were awarded Social Security disability and you are not 65 yet, compared to what's available to you and kind of some different rules when you're joining Medicare for the first time when you're turning 65. Another caveat to that is if you're already on Medicare due to disability, when you're turning 65, that is like a golden opportunity that you will never get again that you need to be aware of. Also, Plan F. Somebody joining Medicare should not be paying over $180 a month. I've seen several instances where people are paying $200, $220 a month for a Plan F at 65 years old. Unless you live in Washington or Florida, you're simply paying a lot of money for a plan that you can get essentially the exact same coverage. There's one benefit difference, but when you work out all the numbers, it really comes down to paying too much. completely get it. Plan F has been the Cadillac plan that everybody has sworn by for a lot of years. But there's really just some more strategic things you can do. So that's been a huge part of the conversation. Or just overall, I've talked to people who had no idea that you pay for Part B, that's going to come out of your Railroad retirement check. So new to Medicare, joining Medicare for the first time. Also, a lot of really in-depth conversations with people who have Medicare and are eligible for the UPREHS benefits and will have the Medicare secondary plan. There's so much to be discussed about that, so I'm not even going to get started, but promise to make more information available to you. But just know that the UPREHS plan, sorry, that's a mouthful, is not hands down unequivocally the best option available to you for everybody. Some people, it's definitely the thing to do. A lot of other people, not necessarily. You really need to compare benefits, compare costs, compare the benefits that you get for what you pay. It's a multi-layered kind of comparison that you need to do when making these decisions. So there's a lot to, at least, if nothing else, see about how the UPREHS plan works compared to the options that are available to you. And I've put together a very in-depth kind of comparative analysis. The third one, also really, really big, is retirees who are on Medicare, joining Medicare, and have a spouse that is under age 65 and needs a coverage solution. So I know that UP makes available to people, maybe it's not the same for everybody, but some variants of, just over $400 for a plan that's kind of watered down. I don't think it even has prescription benefits, all the way up to paying $1,200 to keep the coverage that they had through COBRA. That is astronomical. It would be a very rare situation where I think somebody would need to pay I almost said 12,000. It's over 12,000 a year, $1,200 a month for a COBRA plan. There are absolutely options available out there for coverage, for sure under $800 a month, very commonly under $500 a month, where you could potentially see no out-of-pocket costs in a year, depending on the services that you had. So I think that that's definitely something worth talking through and understanding your options. Things changed in 2019. The current administration in DC eliminated the individual penalty for not having Affordable Care Act compliant health care, which was basically that income tax penalty people receive for not having insurance. Well, that went away. Would never suggest that somebody goes without insurance, but what that did was allow insurance companies to start selling more flexible, more affordable insurance plans. It's a really long story about how all that works. I'm happy to talk through it with you if you're very interested in it, but basically it made a lot more affordable options available. And I think it's worth understanding what those options are. The fourth topic that I talked to a lot of people about were their current Medicare coverage. So, I talked to several people ranging from, they had their Medicare started a week or two ago, and it pains me when at some point in the conversation somebody says, "Oh, I wish I would have talked to you before I enrolled in this plan." The good news is your first 12 months in Medicare, you usually have quite a bit of flexibility to make some changes if you're not comfortable what you enrolled in. Usually within your first 6 months, you're wide open to make changes. But in some cases, up to 12 months until open enrollment, the annual enrollment period in the fall, to make changes if it's your first year in Medicare. A lot of people too just weren't fully aware of what they enrolled in. I was having a conversation with a guy in Iowa who was telling me, I'm so jealous about all these golf trips and traveling him and his wife had already done in the 2 months since he retired, and they had a whole year worth of stuff planned out. And I made a comment asking if his wife was on the same plan that he was. He was on exactly what I would have recommended. And he said, oh no, she's really healthy. So she enrolled in one of those plans without a premium. So she doesn't pay anything for it. I knew right away that meant Medicare Advantage plan, and it automatically kind of sent off some red flags for me because of how much they were traveling. And she was not aware that even though it was a PPO, which usually means you have a nationwide network, it was a local only PPO, which means most of the places they were traveling, if she would have needed medical care for anything other than a life-threatening emergency, it likely would not have been covered because she would have been out of the network. It would have been subject to a $10,000 deductible. The very last topic that I had a ton of conversations about with people is kind of the additional benefits that, anytime you retire or take on a new job, have a big life change that impacts your insurance, everybody's focus is medical and prescription drug, which makes sense. It's by far the most expensive and the most important one that you want to have. But there's a lot of other little benefits that are easy to forget about, or the information definitely isn't as easy to find. So people think it's either not available or they don't even know how to go about it. So I had a lot of great conversations with people about dental and vision plans that are extremely affordable, that don't have waiting periods, that the next day after you enroll, you can go get your cleanings or preventive exams done at no cost to you. If you need to get a crown or dentures or a filling, you don't have to wait 3, 6, or 12 months. You have benefits available to you the next day. And vision, don't pay out of pocket for glasses without insurance. I hear people all the time tell me they pay $400, $600, $800 for their glasses. You can get a vision plan for under $11 a month, that you're gonna pay a $25 copay for your exam and a $25 copay for your lenses, and a frame allowance that more than covers most people's lenses. So, please know that there's information out there. There are plan options available to you beyond, what you were offered probably when you went to Omaha to retire. It's also a lot to navigate and try and figure out by yourself. That is another point I want to make. I talked to a lot of retirees who were very informed and absolutely put in work. I was impressed about the level of knowledge that people had, but I'm just here to help. I get a lot of satisfaction around helping people, get to a better place with their healthcare because it directly impacts their finances. Probably one of my favorite all-time stories has happened within the last month with a Union Pacific Railroad retiree out of Missouri. He retired on Medicare, wife still in her late 50s. We talked several times throughout the month, but yesterday on May 1st, she started her new coverage and was able to cancel the other health plan that she had, and is saving over $400 a month in premiums. We also made an adjustment to his Medicare plan and saved him over $100 a month. All in all, they're saving almost $550 a month. That's over $6,600 a year. And if the wife were to experience the same medical events that she did last year, that racked up $5,000 in medical bills for them, if she experienced those same events this year, based on the benefits that we enrolled her in, she would likely have no out-of-pocket costs. So if you add that $5,000 to the $6,600 that they're saving in premiums. I love to be able to help people like that. So, as you can tell, a lot of information has come out of all of these conversations, and I've put so much of it together. I do want to make sure that more people get a chance to see it. I'm not here to convince you to do anything. I've told several people I'm a horrible salesperson. So don't feel like if you engage or interact for more information that you're going to start receiving harassing calls from me or robocalls. I will not rent, sell, or lease your contact information. But whatever level of help that you do want, I'm more than happy to provide. So here's what I'm going to ask of you, because this is the best way I can think of to get you the information that is going to be applicable to you. So go ahead and click the link below the video. It's going to take you to my website. You're going to click the green button about Learn More. And I really just have a couple of questions, basically having you kind of select either the, of those 5 topics that you want more information on, or which one of the categories applies to you. That way I can send you that information. And like I said at the beginning, you don't have to sift through it or, make sense of a bunch of stuff that won't apply to you. And then I will send you via email some much more detailed information. It might come in a couple different pieces, just so it's not too much at once. But again, I am here to really just make sure that you have the tools, the information, and the knowledge that you need to make the right healthcare decisions that also fit you financially and for your healthcare needs. So you can give me a call. The number is right here, 785-370-3017. If at any point you have questions, you want to talk through your individual situation, because your individual situation absolutely becomes the most important factor at the end of all of this. Nothing with Medicare is one size fits all. If I can say anything that hits home, it's that nothing with Medicare is one size fits all. So information that you always, thought to be true, or what you always heard people say, that stuff changes. Medicare is undergoing huge changes with the MACRA Act that go into effect January 1st of 2020, which should be impacting decisions now. And what's best for your spouse, your sibling, your neighbor, your best friend is, unless you have the exact same health conditions and health history, the exact same medications, the same plans likely aren't the best for both of you. So just know that I'll give you as much general information as possible, but there's always going to be that individual piece that needs to be factored in at the end. Feel free, like I said, give me a call. Number's still listed right here. If you have questions, want to talk through your situation, you can also email me, which I will list here as well. I hope you find this helpful. I'd love to hear about it. If you're able to save some money, it'll make me feel good about what I do every day. And again, please don't hesitate to reach out if there's anything I can help with.